Hey there, and welcome. If you're watching this, chances are you're either getting ready for hemorrhoid surgery or you're in those first few days of recovery. We know you've probably got a ton of questions, and honestly, the road ahead might seem a little intimidating. So think of this as your friendly, straightforward guide to getting through it. Let's jump in.
So, the big question on your mind is probably this one. What is this really going to be like? It's all about understanding the process, knowing how to keep yourself comfortable, and recognizing what's normal so you can heal up with confidence. We're going to walk through every step together. Here's the game plan for our chat. First, we'll talk about what to expect right after the surgery. Then, we'll get into the practical, hands-on stuff for managing your recovery. We'll also cover potential complications, not to scare you, but to empower you, and we'll give you a super clear checklist for when to pick up the phone and call your doctor. And finally, we'll look at the big picture, the path to feeling great again.
Okay, let's start right after your procedure. Just getting your head around what to expect in these first few hours and days is probably the most important step for a smooth recovery. Let's be real here. You're gonna have some pain. This is a real surgery in a very sensitive area. But, and this is a big but, the pain is absolutely manageable with the right plan. It's also so important to remember that everybody's different. Your healing timeline is yours alone, so please, try not to compare your journey to someone else's.
Now for the part where you're in the driver's seat. Managing your recovery isn't just about waiting around to feel better. It's about having a proactive plan and taking control of your healing.
Okay, this is a pretty brilliant strategy. Your doctor gives you a head start by using a long-acting local anesthetic during the surgery itself. That can give you pain relief for up to 72 hours. Then at home, your first line of defense is going to be non-narcotics, like ibuprofen. This whole layered approach is a game changer because it means you rely less on narcotics, which can cause constipation, and that is the last thing you want right now. You only use those stronger pain meds for breakthrough pain. And seriously, don't underestimate the simple magic of a warm sitz bath. It's so soothing for that area. All right, let's talk about the moment that causes the most anxiety, the first bowel movement. But you can totally prepare for this. The goal is simple, soft and easy to pass. So hydration is non-negotiable. We're talking at least 64 ounces of water a day. Fiber supplements are going to be your new best friend. They make things soft, not hard. And here's a pro tip. Use a little footstool. It puts you in a more natural squatting position, which helps everything relax. But the number one rule is do not strain. Seriously. If you sit down and nothing happens after a minute or two, just get up, walk around, and wait for the urge to come back.
Okay, let's get into potential complications. And I want to be clear, the goal here is knowledge, not fear. When you understand what could happen, you can spot any potential issues early and work with your team.
First up is something called urinary retention. Basically, it means you feel like you have to pee, but you just can't. It happens because the anesthesia and the swelling around the surgical area can mess with the nerves that control your bladder for a little while. It's uncomfortable for sure, but it's a really well-known issue that's almost always temporary.
And just to put that into perspective, this happens to somewhere between 1 and 15% of patients. So it's not everybody, but it's common enough that your medical team is totally prepared and has a plan to manage it if it happens to you.
This slide is so important because it draws a really clear line. You are going to see some blood. A little bit of spotting on the toilet paper or a few drops in the water after a bowel movement, totally normal. That's just part of healing. What is not normal, and what means you need to call your doctor right away, is passing blood clots or seeing a large amount of bright red blood, like an amount that looks like a bowel movement itself. Okay, this one sounds a little scary, but it's a rare, long-term issue where the anal canal can get narrow from scarring. But here's the thing, your surgeon actively works to prevent this from ever happening. During the surgery, they'll strategically leave little bridges of normal tissue between the spots they remove. It's kind of like when you're repaving a road. You leave some of the original structure in place. Those bridges make sure the whole area heals with flexibility and works just right.
This brings us to a super important, action-oriented section. Think of this as your safety checklist. These are the clear-cut signs that mean it's time to pick up the phone.
This is your non-negotiable list. If you get a fever, that could be a sign of infection. If your pain just isn't getting better with the medication you were given, that needs to be checked out. Heavy bleeding, like we just talked about, is an immediate call. And if it's been more than 8 hours and you haven't been able to urinate, you need to let your doctor's office know. Please don't wait or hesitate on these.
So we've navigated the tricky first part of recovery. Now let's shift gears and look ahead to your full recovery and the great long-term results that are waiting for you.
The one thing to really hold on to during this whole process is this. You are having a procedure that's considered the gold standard for a reason. And hey, don't just take my word for it. This quote from a major surgical textbook says it all. The surgery has excellent results. Things rarely come back, and there are few complications. It really works.
At the end of the day, remember this. Healing is a process, not a single event. It's a journey with some good days and some not so good days, not a finish line you just cross. Be kind to your body. The vast majority of patients get through this recovery just fine and are thrilled with the results. They finally get relief from the symptoms that led them to surgery in the first place.
So, we'll leave you with a final question to think about. By understanding what's happening, following your post-op plan, and keeping the lines of communication open with your medical team, you're not just a patient. You are an active, empowered partner in your own healing. Keep asking questions, and here's to a smooth recovery.